Hi everybody, my name is Brent Braveman and I'm a candidate to be the next Vice President of the American Occupational Therapy Association. Voting opens on January 6th and ends on January 27th. Between now and then, I'm going to share a series of blog posts and videos to introduce more about me as a candidate, an occupational therapy practitioner, and a leader. Today, I'm going to start by sharing some information about my background and experience in clinical practice, because I believe it's critical that AOTA leaders are solidly grounded in clinical practice. We need to remain connected to you as practitioners and to deeply understand the challenges and struggles and the complexities of what it's like to try to provide top quality occupational therapy service in today's complex practice environments. So let me tell you about my experience. My first couple of jobs were in the area of acute care and inpatient rehabilitation, particularly in spinal cord injury. I worked for a number of years at the National Rehabilitation Hospital in Washington, D.C., and for 1 year in a program focused on helping patients with high-level quadriplegia transition from one ventilator system to another. Wow, that was a great learning experience. It taught me so much about human perseverance, about human spirit, and about occupation. It also taught me that I needed to know a lot more about occupational therapy theory and the development and implementation of evidence. So I decided I needed to get a doctoral degree. A few years later, I moved to Chicago and I joined the faculty of the Occupational Therapy Department at the University of Illinois at Chicago. I had the role of Director of Clinical Services in the Academic Medical Center. I led a team of 16 occupational therapy practitioners, and boy, our hands were in everything. We had an inpatient rehab unit, lots of different types of acute care patients. We had a neonatal intensive care unit where I learned to hold infants, to provide sensory stimulation, and introduce feeding. We had a hand rehabilitation program. We had 2 mental health units, one for adolescents and one for adults, where I helped provide group and individual service to mental health clients. We also had a work readiness program. This program was focused on helping people develop the basic habits that would allow them to be successful if they entered a work training program or went back to school. It was through introduction to that program that I developed my interest in the area of work disability. So when it became time to name a focus area for my doctoral prelims, work disability it was. And this is when I got really lucky. I was introduced to a community-based health organization that had just received funding to develop a pilot return to work program for people living with HIV/AIDS. So I took a chance. I took a shot. I gave a pitch, and I convinced them to subcontract the development and delivery of that program to me. Doing that not only provided me with the data that I needed to successfully defend my doctoral dissertation, it also provided myself and my research partner, my mentor, my friend, Gary Kielhofner, and I, the data we needed to apply for and receive a series of 2 large federally funded grants. The first provided an outpatient rehabilitation program, employment program for people living with HIV/AIDS. The second focused on clients living in assisted living facilities, also people living with HIV/AIDS, but also with mental health and substance abuse issues. This program focused on helping them develop the skills to be successful in work training programs, in getting a job, in volunteering, in going to school, or in living independently in the community. 10 years ago, I accepted a new challenge and moved to Houston, where I've served as the director of the Department of Rehabilitation Services at MD Anderson Cancer Center, the #1 cancer center in the world. I lead a large department with over 100 occupational therapy and physical therapy practitioners. My job is to work with them every day to develop and implement high-quality oncology rehabilitation services, but also cost-effective rehabilitation services. It's my job to help them face the challenges of productivity, of documentation, of billing and coding, the complexity of justifying durable medical equipment, and now the challenges of doing all of that with the added restrictions of the COVID-19 pandemic. It's my job to help them identify the obstacles to doing a great job and to help them remove them. I'm connected to the delivery of clinical practice every day. Of course, I've not had experience in every area of occupational therapy. I've never worked in home health. I've never worked in the school systems. And it's been 30 years since I worked in long-term care. So in order to be a successful vice president, I need to engage with you. I need you to share the challenges that you face. I am committed to learning about the complexities of delivering occupational therapy services in your setting. Over the next few weeks, I hope you'll take the opportunity to connect with me. You can do that by finding my website at www.brentbraveman.com. You can email me at bbraveman@gmail.com. Become a friend on Facebook. Reach out and we'll have a telephone call or a Zoom meeting, because I am honestly committed to learning about your needs and to helping the American Occupational Therapy Association become a much more effective member service organization. Thank you for listening today. Please watch for my blogs and video posts, and please reach out to me. Together, I am sure that we can do great things. Thanks, and have a great day.